Good afternoon, everyone. It's now 1 o'clock, so we're going to start our last installment of our January virtual series. My name is Dan Saipan. I'm the GEL, or Global Experiential Learning Director here, and we have a great webinar here in store for you all today. I thought it'd be a great opportunity, especially now when we're getting vaccinations out and people are urging to travel all over the world. What are safety procedures and what is it like out there to actually travel? So we have some experts from CIEE today that's going to explain to you all the risk and all the rewards of traveling during this time period. Just to let you know, as of this semester, we're still not traveling or not physically traveling. We're virtually traveling, but not physically traveling with you all. And we'll continue with these virtual programs throughout the semester. We've added a new feature of caption to these workshops. So if you do not see the caption on your screen, you can actually just go to the Zoom toolbar and click show subtitles, and that should be sufficient to show your captions on the screen. Of course, with everything we do at GEL, we are very student-centered, and without my team, I couldn't do all these activities and all these webinars and hopefully all these trips that we're going to do in the future. So I just want to introduce my team now.
Hi, everyone. My name is Elena Puff. I'm a fourth-year PhD student in the school psychology program here at the University of Arizona. I'm the graduate assistant for GEL. Thanks for being here.
Hi, everyone. My name is Jasal Del Cid. I'm a first-year PhD student within the College of Education in the Educational Leadership and Policy program, and I am the community lead for our program here at GEL.
Hello, I am Leslie Soto. I am a current senior at the University of Arizona. I am majoring in speech, language, hearing sciences, and I am a current intern for GEL.
Okay, so before we get started with today's exciting program that we have for you all, I want to take a second to explain to you what GEL is. As Dan mentioned, GEL stands for Global Experiential Learning, and we are a distinguishable program here at the University of Arizona that seeks to integrate travel, education, and service learning students here at the University of Arizona so that they can build both the knowledge and the skills for their undergraduate career and beyond. We focus our efforts primarily on increasing access as well as participation, traditionally marginalized students who may not have the opportunity to travel. These students include first-generation students, DACA undocumented students, and students from low SES backgrounds. Here at GEL, we believe that all students should have access to travel opportunities in their education. Pre-COVID, we offered both domestic and international travel opportunities to students at all. For some of the trips, students were actually able to earn academic credit for their participation in our programming. And really the separate focus of both trips were grounded in principles of social justice, environmental justice, cultural identity and exploration, and also parts of service learning.
Before we continue with the webinar, we at GEL would like to acknowledge the land in which we sit upon. With this being said, we want to share with you this acknowledgement video that was created by the UA American Indian Alumni Club.
Skiktash Wasajamai, Anian Upjigik, Amy Len Spotted Wolf, Aniapam Amjad, Judge Shaik, Wawikir Dikshan, Tanatum Joed. Annual Miss Indian Arizona 2020-2021. Good day. My name is Amy Lynn Spotted Wolf, and I come from the Fresno Canyon community in the Babikiwi district on the Tanatam Nation. I am a senior here at the University of Arizona studying elementary education under the Indigenous Teacher Education Project. I am Miss Indian Arizona 2020-2021. Samach Achmach An Tanatam Hajurika Dam Oyopo. We acknowledge our presence on the Tanatam ancestral lands. For time immemorial, the Tanatam have been part of this landscape and the University of Arizona. The rich history and connection the Tanatam have to the University of Arizona is visible in the land. The saguaro, agave, ocotillo, and creosote bush used to beautify the university campus are sacred plants to the Tanatam. The mountains that surround the University of Arizona and contribute to the advancement in the studies of the Southwest at the UA are the homes of our ancestors. Babatoag, also known as Mount Lemon, Chimamactoag, also known as Tumamak Hill, Toakuo, also known as Santa Rita Mountains, are just several of the many mountain ranges important to the Thanatam culture and identity. Our connection to the land is living and breathing in us here in Chikshan. We use this connection to the land and our ancestors to guide our studies at the University of Arizona. Tahugi, Sapa, thank you. Skriktash was a
During this webinar, participants will have the opportunity to ask panelists questions using the Q&A feature at the bottom of your screen. Please feel free to ask any questions and we will take the time towards the end of the presentation to answer them. Thank you. I will now pass it on to Elena.
Okay, so right now I want to provide you guys with a little bit of a program overview in terms of what we're going to talk about today. So this presentation will feature the International Study Abroad provider, CIEE, as their Risk Management, Health and Safety Security Department present their ongoing study abroad programs. Since August, despite COVID-19 travel restrictions, CIEE has successfully hosted over 2,400 students in 15 different countries around the world. Today, we will learn from their experiences about how they assess risk regarding travel, what they are tracking to help guide them in making determinations to run or not run a program, and what are their lessons learned to date about studying and traveling amidst a global pandemic.
And so this brings us to our next slide of introducing our speakers for today. First, we have Bill Bull, Vice President of Risk Management, who brings more than 20 years of experience in safety and security in his current role, including 4 years with CIEE. Most recently, Bill served as Vice President of Program Management, overseeing study abroad programming quality for nearly 200 programs in more than 40 countries. Previously, Bill served as the CIEE Director of Health, Safety, and Security. We also have Molly Bestie, Assistant Director of Institutional Relations, who joined CIEE in 2011 after spending nearly 5 years teaching and working in China. In her current role, Molly provides helpful tools and support to study abroad offices and advisors. And Molly has experience presenting at state and regional and national conferences. She grew up in Maine and earned her BA in communication from the University of Southern Maine. Thank you. And we will now continue with our next slide.
Sorry, queuing it all up. Hopefully it's starting to share now. Take me a moment here and then we'll work from there. One moment as I change settings. We'll get there.
We will. Thank you, Giselle and team, Elena and Dan and Leslie for the wonderful introductions. We're really excited to be able to join you all here from where we sit. Bill is in Maine and I myself am in Michigan. And we're excited to talk to you a bit about the future of study abroad, current realities as they are. Study abroad seems like a very distant option for most of us, but as you heard maybe in the introductions, that CIEE was able to actually work with students to facilitate some study abroad options. And I wanted to just kind of, while Bill's pulling up our slides and presentation, I can tell you just a little bit more about CIEE, who we are, what we do. The acronym stands for the Council on International Educational Exchange, and we were founded in 1947. So we're coming up on 75 years of history here. We are the oldest and largest study abroad organization and international exchange organization here in the United States. And with those 7 decades of experience, you can imagine that we have facilitated life-changing experiences for tens of thousands of students, and we're constantly monitoring and adjusting to world events. COVID-19 being one of those world events. And since the outbreak, I think a lot of universities, students, parents are wondering, is now the right time to study abroad? And so that's what we'll be talking to you about today.
So let me interrupt. Did I get the screen showing correctly, or are we still missing?
It's not presenting yet, Bill.
I'll try and fix it.
No problem. We'll give it a second. We've got time, and I think for the attendees, it's worth sticking around to hear what Bill has to present on. So, excuse the technical difficulties. Here we go.
And
beautiful.
Is it showing the full screen the way it's supposed to?
It is. It looks great. So this is the agenda that we'll be going over today. Bill and his team, the health, safety, and security team, are the ones who are monitoring what's going on all over the world. And so, COVID-19 is definitely a risk factor that we are all probably yourselves included, are still struggling to understand, but it's really only one of the risk factors that Bill and his team take into consideration when they're monitoring, study abroad all over the world. So what he's going to speak to you about are using CIEE, study abroad programs as case studies, really the mitigation strategies for risk in general. And then we will spend some time on the current situation here in the United States and comparing them to the situations abroad, so that you can really kind of put into perspective realities of traveling in today's world. We'll definitely have time for Q&A. We did want to give you a little peek into our global footprint. So as you can see, these are representing CIEE study centers around the world. So these are for our college study abroad, as well as our high school abroad and gap year abroad programs. And we are represented, in more than 30 countries. So Bill and his team have a lot of work to do. And so it just gives you an idea of kind of the large overall footprint and what we are looking at today. And so without further ado, I will hand it over to Bill Bull, our Vice President of Risk Management for CIEE, and he's really going to dig in to the facts, the data, and the realities. Bill?
Okay, thank you, one and all. I'm sorry for any of the confusion on screen sharing. I'm glad we practiced it first so I could blow it in the live action version, but there it is. Yeah, we're going to walk you through sort of the things we're looking at as we start thinking about travel safety, study abroad, and what's actually happening in each location where we're operating. What are the risks for those locations, and how can we mitigate those risks so we can help you understand. Then I'll end up talking more about travel safety in general and ways to mitigate risk, because someday we're going to return to travel, if not today. So a couple little things about data. I'm doing this early on because, not just because I'm a data geek, but because I probably have your attention a little more. As you can see on the chart in front of you, we've been measuring and tracking the health risk for each of the locations we're at since starting in April. And we created an index and a framework that measures and weights various capacities within safety about each country's monitoring and detection capacities. What's their medical system going on? How effective are they able to quarantine and contact trace? What's happening within their systems about healthcare availability and testing and their government responsiveness? And we gave all those weights. And we started back in April. You can look on the slide that says what the numbers were. What's most interesting to us is how those numbers have changed. Have conditions improved? What's been going on? And for those of you that are data geeks at all, these numbers tell the story. They tell the story of how things were, how things got better, how things worsened. We ebbed and flowed throughout the world at various locations for the most part. There are a few places that were not as good in April, but are better now, but not so many, but there's a few of them. Singapore being one of them. And what we also discovered was that this tool was able to sort of predict it became a little bit predictive as we watched on. And, we were able back in November to sit there and go, oh, geez, holidays are coming. This is going to be bad. Like right now, we're looking closely at China saying, and the Asian countries, the Lunar New Year is about to start. Are we going to see any changes in the Asia region roughly about 2 weeks after the holiday, just like we saw here in the US? We did recognize and learn, though, that as we got into this month after month, that it was also important to look at, on the far right of this chart, the HRR, the Health Recency Report, what's been going on in terms of case count in each country over the past 2 weeks. And as we started doing that, we started looking at it and also realized that it might be interesting to look at the data, and we threw it into as if each state was a country, how would it compare to the world? So that became a very interesting way to look at this, because it's one of the ways to think about what is your risk to travel. Well, you kind of have to know what the risk of staying is at the same time. So if you're sitting in, well, I'm sorry, Arizona, which honestly has been leading our charts for a while, one of the places in the US for the most cases over the past 2 weeks, Portugal recently became worse, having a worse situation going on right now. But if you pick, the US in general, that's the pink line in the middle. You can see to the left of the US, those are all the places. And in green, those are the countries we operate that, if you're in Florida and you want to travel, we'll certainly look to your left and you can say, well, France is doing better, and Netherlands is doing better, and Chile is doing better. And all this better being over the past 2 weeks of the number of cases and how it's going on and how it's being managed. We threw this in just last week into another way of looking at it with the different percentiles, with the US in the middle and the 10th highest and the highest in the US. And even this, how rapidly this is moving, you can see that a week ago, there was Arizona there on the far right, with averaging over probably about 1,700 cases per 100,000 over the past 2 weeks. And Portugal was down there, high, but significantly lower. But in the course of just the 1 week, as you can see on this chart, going back, Portugal has had a rapid increase. And that's being attributed to, of course, there was the Christmas holiday there, but also a function of the variant of the disease we're seeing there is more virulent, and it's spreading throughout Portugal. So we track this, so we understand what the risks are, what's going on. We had a program that was slated to start in Portugal this week, and we said, no, we're going to delay the start. Other places we've been able to start and run. Now, when we're looking at running programs, we do everything you guys have probably been focusing on as well. We've got a whole set of fundamentals that drive our processes to help the students keep themselves safe, help our staff keep themselves safe. And you probably are doing all this on your campus. Certainly as we track around the world, I can report to you that this stuff works. When we see countries implement restrictions and those sorts of things, the charts we can show you, we can go back and I could point to the date they applied restrictions, because then you could track it 2 weeks later, the numbers started dropping. And you can even track when they released the restrictions, because then the numbers started rising a little bit then. But the fundamentals work, the whole distancing of 6 feet and masking and hand washing and, worrying about ventilation. Collectively, we've got a whole model that we like to use and make sure our staff and our students understand that, it's the culmination and the collection of all of these different things. It's the unified mitigation model, the Swiss cheese model, some may call it. And hopefully you've heard of it and you're doing it, that it's not merely enough to do physical distancing. It's Swiss cheese. You use physical distance, there are holes in it, it's going to go right through. If you do physical distancing and masks, well, actually, it's harder to get through. You throw hygiene on there at the same time. You throw testing on there at the same time. You throw hand cleanliness on there at the same time. And all of a sudden, you start creating a set of standards that lower the risk and likelihood of any student or staff being infected with COVID-19. And we have found this to be very successful, because, as we said, we've applied this model for over 2,400 students. We're about 2,500 right now in the 17 countries. And, how has it worked? Well, what we have seen is we've had 9 cases, 7 of which, though, were caught and noted by our testing on 5 days after arrival, meaning they arrived with COVID. We only had 2 students out of the 2,500 that got COVID while on our programs. One was in a homestay family, and another family member had gotten it. And then the other student was in Germany, and we're not really sure. But what we do keep seeing is that the people these days are taking the pre-test 3 days before the flight, getting on the flight and arriving. And what we saw certainly last week with the 5 we just had was there was a belief that being negative to get on the flight meant that you were just plain negative. And frankly, what we keep seeing when you are negative, and then you go into a situation like a travel situation where you have increased exposures, that we keep seeing that we keep finding new positives afterwards. So know that a negative test doesn't mean you're off the hook. It means you now need to be more careful. And many countries around the world have protocols and standards that are similar to this, that apply with a 3-day testing before you fly. You are isolated upon arrival. You are retested, and some places retested again. South Korea, Indonesia, Taiwan, all those places have a very robust isolation for a short period of time with a multiple testing regime, which then determines once you're given a fit to be free, or you know you're free. Those countries with the most robust processes like this actually have the least COVID in the world. And that's our data, our numbers show that. So we find, though, this set of protocols of making sure everyone's well aware of their role in it, making sure the students don't mess around with it, our staff don't mess around with this, has been our best successful mitigation around these sorts of things. We've learned as well that, you know, if the airline or the country says you need a negative PCR test or a negative test 72 hours before, that doesn't mean 84 hours before. That doesn't mean 90 hours before. It means 72. And we've had students denied boarding because they got tested too early. Oh, it wasn't convenient, some had said. We've had students arrive in country and said, actually, this was the rapid test, which is not the PCR test that we require, and therefore they've been turned back. So really, if you're going to be thinking about traveling, and we will certainly, if you're traveling, let's help you on that one, but you make sure you pay close attention to this. Just today, we had an interesting one where a student got the test 72 hours before flying, and they were 72 hours as of Sunday when they flew. They had a layover in another airport, and another day passed. And as they then went to board, it was now more than 72 hours. They were denied boarding. They were retested, and actually they tested positive. So now they're in quarantine in this other country as they're waiting to continue on their journey. And they feel fine. The country's helping them, we're helping them, and they're good. But really pay attention to what the instructions are, and know that unlike, well, I don't want to be too political here, many countries are taking this strictly serious. So if you want to travel, you can travel, but be very careful with how you're traveling and what you're doing there. We do have a social contract for all of our students, and we recommend if you're going to travel with a group or amongst each other, do talk to each other and commit to each other about being COVID smart and COVID safe, that, you know, you're not going to wander off and one of you is going to go out and party all night long, so to speak, and then come back and infect the rest of the group. Talk to each other about how you're going to keep each other safe. That's critical. We keep seeing that. One of the things to really be careful and know is that, you know, as I sort of alluded to it there, is that each of the countries around the world are taking it with various degrees of seriousness, and some deadly serious. I mean, strictly serious. You get on a bus in Germany and you don't have your mask on, it is a 50 euro fine on the spot. You either pay them with a credit card, because it's Germany, they can do that, they can give a credit card, or they take you down to jail, and then you have to find a way to get the money to them. They don't mess around. You pay it right there. If there are restrictions on your quarantine, South Korea, Germany, Europe, upwards of a 25,000 euro, $30,000 fine if you break quarantine, and then they deport you. So understand what the regulations are before you do that, because, you know, they're working hard to control this, and their governments and their officers are taking it very seriously. So we work hard to make sure all of our students understand this, and we do it in ways, 12 ways from Sunday, and I know they're sick of it, but good gracious, the last thing was a student to say, I didn't know, and end up in trouble. A couple of things as we think about, you know, well, is it safe to travel is a question I love. I don't like getting, because on some levels my response, not tongue-in-cheek, is, well, it's never been safe to travel, nor is it safe now. That's the wrong word. The question is, can I mitigate the risk, and how risky is it? And as we think about, you know, well, should I travel, should I not travel, how risky is it? I think, you know, today we should need to look at the conditions of where you are. How risky is it to stay? I live in Maine. Maine's done pretty well, though we are seeing an outbreak up here right now. Today we had 400 cases in the state, which is huge for us. But I would look carefully at where I was going. I've got a daughter who's in sophomore in college myself, who's desperate to travel, and she's going to. but it's a question of where's she going to go. And I would say at this moment, well, let's wait for Portugal to calm down and get the disease under control before we go to Portugal. But there's lots of places in the world where the disease is being well managed, where people are behaving responsibly. To be honest, though, the best places for successful management right now are places that don't let anyone in. So maybe we can't go there yet. We can't go there yet. China, Indonesia, Taiwan are knocking it out of the park. South Korea is allowing some travelers, but they require a 2-week quarantine and 3 tests. Thailand has a testing and a quarantine program going on, and that's been very successful. But as you think about travel, I mean, we've got the State Department warnings out there, and they are helpful. They don't tell the full picture because they actually don't assess the US. So think about your risks of staying and your risks of going, and more importantly, think about your risks or your ability to maintain your own health and maintain following the guidance, because the less you follow, if you're likely to take your mask off and go out drinking and party all night long, well, you probably shouldn't go. That's not going to help you. And that's part of the issues that we want to make sure is well under control. You should talk to your doctor if you're thinking about going, making sure you don't have an underlying condition that might increase your likelihood of either getting it or increase the impact if you do get it. And I think the last thing anyone wants to be is somewhere else away from home, sick with a condition that makes it worse and being unable to travel. So think carefully about that if you're going to want to consider traveling. So if you're looking at travel, and what we look at and what you guys can look at is look carefully at the spread of the disease. You can look at our website. All this information is posted up there. Johns Hopkins has some great stuff. The European Centers for Disease Control has great stuff. Google has great stuff about what the spread is like. Look closely at what the public health capacity is, and you see reports about, public health care system is being overwhelmed. Well, traveling to London right now is not a good idea. The healthcare capacity is struggling right now. We don't want to add to that problem. We want to make sure that they have it well under control and it's being managed, and they can go there, and you can go there. One of the things you're going to have to really pay attention to is that, the travel realities are changing, and they change quickly. Changes in quarantine requirements and entry requirements. And heck, as recently as a week ago, there was no requirement to have a negative test to return to the US. There now is. That you now have a return to the US, you have to have a negative test shown to get on a flight to come back to the US. And if you're going to travel, you're going to need to make sure you've got a plan for how you will manage a positive test when you're in another country ready to return home. I have here on the slide the ethical travel considerations, and that's what we're getting at there of, make sure you're not traveling to a place where they don't have the ability to well manage the disease, and you might become part of the problem. The realities are out there is that there are rules out there that change as the disease changes. There's some overreactivity, in my opinion, that's out there, but everyone is doing their level best to make sure that the disease is managed, limited. We can't stop the disease. Let's be clear on this one. The pandemic is here. It should stay. Vaccines are not a solution because you can get vaccinated and still spread the disease. The vaccines can limit the impact on you, but the pandemic is going to be part of our world for, probably for your lifetime. What we can hope, though, is it diminishes in scope and scale and impact and becomes as much of a problem as the flu is, which you want to manage, but not so much more of that. But we're not there yet. We're far from there. We're going to be dealing with flare-ups and outbreaks in various locations for several years to come, and that's part of it. But each country manages these rules. They publish them. The airlines publish these guidelines. You're going to want to make sure that you're following them. The testing bits, as the world gets better at it, and I can hope we can continue to get better. There's some interesting things afoot there, but we're not quite there. But if you're going to be thinking about travel, make sure you have a plan. Make sure you overplan, which is a nice oxymoron there for you. But think about, again, that bit of what will you do if you get sick? What type of insurance do you have? Do you have the right insurance that'll cover you? If you are denied boarding in a location, or this poor student who we saw that was caught in transit, will insurance kick in and help out? Or do you have the financial wherewithal to support yourself during that time period? You can travel, but you have to think differently. Things like making sure your tickets are changeable, and or at least you understand what the change ticket fees are. The concept, though, of assuming that you are positive for COVID until you've had several tests is key to not being part of the solution, not being part of the problem, and instead part of the solution. Get tested before you depart. Stay home for 10 days, 7 days before you travel, and control your movement and control your exposure, because the test you get 3 days before travel is a test in a moment in time, and at that moment you may be negative. But if your behaviors the night before, or something happened the night before that led to an exposure, it could be a real problem, and it won't show up for 3 to 5 days after you had the exposure, even though you had a test that said it was negative. The testing they do, the PCR tests are 99%. They're the gold standard, they're 98.7% effective. The rapid tests that are out there are somewhere, depends on which type you're using, between 55 and 74% effective. So many people are using the rapid tests that can get them, but doing multiple tests on multiple days to make sure they're all set. At the end of the day, though, the travel has to do with, there's a truism in the world that the risk is to the traveler, not the location. That it's your posture, your awareness, your ability to limit your interactions in a positive way that will always make sure that you are less likely to get the disease. So, and I have to go on a brief aside, and for those who are believing that, well, I'm young, it doesn't affect me very much. Yeah, unless you're one of the people that it does affect very much. And even if it doesn't affect you very much, and you're in another location, you're still taking up resources and perhaps diverting care from someone who it is affecting muchly. So really think closely, and it's in all of our interests, to maintain our awareness, to make sure we don't get it, and make sure we don't spread it, make sure we're being attention to this. Vaccinations will help, but the U.S. is struggling to get a vaccination program rolled out for everyone, and many countries are worse. And I work with South Africa. You want to know how many vaccinations are in South Africa today? 0. There's none in the country. It's a country of 70 million people. There are none in the country. They can't get it yet. It's supposed to come, but there are a lot of places where the vaccine has not been made available yet. And frankly, for a world in this concept of return to normal, we can't get there until everyone gets vaccinated. So that's going to be a key point as we start looking for the future. And one of the reasons why I think we should plan for this pandemic to be part of us for years to come, because if we're all vaccinated but our neighbors to the south aren't, it's going to come back, and it's still going to be present. So how we act and how we behave is going to be really important. And yet, despite all of that, we still have travelers. We still have these, 2,500 students traveling. We still think travel is incredible. We still think, even in a COVID world, even with the restrictions that are in place, that travel can expand your mind, expand your horizons. And honestly, I've, we went through my introduction, but we didn't talk about the 20 years I spent with Peace Corps in Africa, both as a volunteer and as a staff member, and then regional safety. I've been places, I was sent up into northern Uganda after the Lord's Resistance Army was chased away, and make sure it was safe. I was sent into South Sudan, places where people weren't going yet, or Kyrgyzstan shortly after the coup. And I don't want to say there's a weirdness here, other than, everyone's away hiding from fear or concerns, and all of a sudden, there I was alone in places that would have been filled otherwise, which was just kind of remarkable, which is kind of fun. But you can mitigate your risks by following, the COVID smart practices. You can still travel. You just have to plan and plan effectively. And you have to remember the back of your mind that, COVID is like a wildfire. It has no thought. It just burns whatever it touches. And you can essentially hide yourself from COVID through masking and distancing and hygiene, checking, testing to make sure that the wildfire passes over you. But if, you have an exposure, just like any wildfire, it will jump on you. So make sure you do these practices to keep yourself safe. We've discovered that we're able to limit the risk for our students through these practices, and we're going to continue to do this and continue to offer them because we think travel is still worthwhile. We still think the world's a better place for students who understand other realities and also understand there are other ways of coping with the COVID situation. And those that are in other countries are learning to experience this in ways that you wouldn't get in your home state and even where you're going to school. So I'm going to stop there. I'm going to throw out there, the opportunity for you guys to throw some questions up and throw some challenges up. And I encourage you to challenge me. I mean, I may have made some statements that make you go, wait a minute, what did you just say? And how is that true? And I've always believed if I can't defend my statement, I need to retract it, or at least give you guys an opportunity to understand where I come from, what's going on with it. So shorter presentation, but mostly I think the grist in the mill here is in the questions. And that's just when you can ask me to slow down and explain it all over again. So what you got? Questions, comments, concerns?
I haven't seen any come in yet.
Oh, there we are.
So let's now transition to the Q&A part. We want to begin by everyone that has not made their questions yet. You can go ahead and drop them down in the Q&A box feature at the bottom of your screen. And one of the first questions that we see is, where do you consider the safest place to travel will be within the next 6 months?
So reframing that from where do I think you're less likely to, well, you did say safest, so we'll throw in everything to it because, there are other risks to travel beyond COVID. So assuming your question is, where do we believe that COVID, least likelihood of contracting COVID in the travel circumstance? Well, if I had my choice, I would go to Taiwan in a heartbeat. Then again, Taiwan had the luxury of having a very strong memory of the original SARS outbreak, which you guys may remember from a few years ago. And they actually went on high alert December 31st, over a year ago. And they started monitoring and contact tracing and controlling every arrival before January 1st, before the US had its first case. They saw what was happening in Wuhan. They were closest, and they said, oh, we know what this looks like. We got burned under the first SARS. So Taiwan has been phenomenal on how they've been managing it. They went something in the order of 7 months without a case, a single case. They just had their first case 3 weeks ago. It was an airplane pilot who was caught on the testing process. But it is in the country. Most of the Asian countries, the PAC Rim countries, Australia, New Zealand, China, Singapore, Thailand, are doing a significantly better job of managing the disease from a control and contact tracing aspect, meaning they're accepting that existence, and if anyone shows up with it, they're being caught, they're being captured, they're being isolated, they're being quarantined, and they're making sure it doesn't spread. And they've got high quality medical care, so I would say anywhere in PAC Rim, though Taiwan, man. If they let people in, I'd go there. Australia, New Zealand, Thailand, China. China's up to, after months of very, very few cases, something in the order of 300 to 400 cases a day in the entire country. And when they have a case show up, they lock things down fast. So those are the places I am predicting will be safer to travel first.
Okay, awesome. So the second question that I'm seeing here is, are quarantine sites paid for by the country when visiting?
No, for the most part, countries that are requiring quarantines, I would say it's a cost to the traveler. That it has to be part of the cost of travel. I think, again, since the predictor questions are here, is I do think we're going to have increased travel costs for the next little bit. That the days of really cheap travel are a few years away again. That the governments are working to provide controlled environments for those who arrive. They're charging for it. They're not charging a lot in the grand scope of things. What Taiwan was charging, just like South Korea, around $100 a day, which no is not cheap, but that included all foods, included all the costs of testing and retesting. So housing, lodging, high-speed internet, and 3 meals a day, snacks, and testing and retesting, and access to medical care if you need it. Not cheap, additional cost. It's not the Europe on $5 a day or $20 a day, but there's going to be a cost of doing business, I think, as part of the travel world.
Okay, thank you for that answer. I'm seeing another question in regards to COVID that says, what procedures do we do if we contract COVID in another country?
Aha. So actually, as you can imagine, for our program and our students, we've got, I could show you the slide, a stupidly complex slide of all the different if this, then that slides. It was a lovely logic model slide we built. At the end of the day, though, you will, if you're in another country, you contract COVID, fall under the guidance and regulations of the public health systems of that country. So depending upon where you are, they will either identify where you are to stay while you rest and recuperate. The UK right now has announced that, a foreigner gets sick and they have to go to the select places they have identified. But you'll fall in the public health structures and they'll tell you where to go, how to go, and they will contact trace. Many countries do have apps that every visitor is required to. South Korea is a great example. They're not going to be allowed to board the plane unless you show you have a connected phone, Wi-Fi ready, and that you have downloaded the app that allows for contact tracing. For the privacy-minded of us in the world, there's a lot of stuff out there about just how privacy is protected on these apps. And they're pretty remarkable about how the multiple layers of privacy that are in there for you and the rest of your bio data. But they do have requirements. China, the same way. All of China wakes up every morning, enters their daily temperature and their symptoms, and they push the button and the code goes to the regional public health office, who then reviews it. It's automated these days and sends back a green approval code, which they have to show to get into any building in the country. Department store, grocery store, classroom. You have to show your QR code, just like you're getting scanned at the checkout line. If it's green, you're allowed in. If it's red, you're not allowed in. That might be a tangent, because what was the question? What do you do? Yeah, so what do? You inform the public, you make sure you'll know you're tested positive because you're in part of the medical system there and the healthcare system, and they will provide you immediate guidance of what you're supposed to do. Short and quick answer is mask up and isolate. And you are correct that most people recover, but you want to make sure you've got access to medical care, and they will make sure you have access to medical care should you be one of the percentage that, there's worse wrong language. We talk about the death rates or whatever percentages it happens to be, and we don't know that yet. What is less talked about is the percentage of people with long-term issues, and that's significantly higher than the death rate. And none of us want to be part of those people with significantly longer impact. Not as simple as loss of taste or smell, but there's a host of ancillary things that come along with this disease that negatively impact the quality of your life for years to come. And no one wants those either. But you want to have access to medical care in case you're in that subgroup. People love my talks. They always say I give such happy talks about sunshines and flowers and rainbows.
Thank you for that answer. There's another similar question, kind of going back to the previous one. It says, what airlines have the best procedures?
Well, let's see, I have to do the full disclosure because I am a frequent flyer historically with Delta, but I have been impressed with Delta. They're still maintaining their empty seats in the middle process, and that whole alliance that is Delta is doing a solid job of that. Airlines are doing a lot of work to maintain proper ventilation. They've rejiggered their airplanes and all the air recirculation issues and cleanser issues on flights. So that's all good. But part of your issue has to get back into what is the boarding process like and the pre-boarding process like. And not surprising there, but the low-cost, more budget carriers have less robust systems for pre-boarding the plane and how they have you packed in that area before. So I like to say invest in your own safety. I would select an airline that has a good reputation for these issues. And I don't want to slam other airlines per se, but there are, you know, like everything else in the world, you get what you pay for. How's that for a non-answer? Answer.
Okay, I'm seeing a question. Someone wants to know if testing is free in other countries.
Yes. And actually, here's the interesting bit. And even with most of the insurances, like all of our insurance, if a test is deemed we're going to have some issues out there. If a test is deemed medically necessary, it is covered by insurance. Certainly, CIEE has, you know, partners with iNext, our insurance, offering that, you know, if you know, COVID-19 is treated like any other disease because it's a disease, and if you require testing, it's a covered expense. What health insurances and travelers insurance and medical insurances won't cover is the need for testing for boarding a flight. That's not deemed as a medical expense. But if you have a lot of places, if you know, a doctor orders your test because you're symptomatic, it is likely to be covered. Not always, because, you know, the world is strange. But if you're getting, most places currently are not covering the cost of testing to determine if you were fit to fly. And the cost varies. We keep a spreadsheet of the cost by location. The range is between 60 and 140 bucks for the testing ahead of time per test.
Okay, awesome. It's a really good question. Someone's asking, can we still travel for leisure, or is it mostly for travel for school and business?
Okay, so there's interesting, that is a really good question. So there are some countries out there that allow for leisure travel, like Maldives. You can go to the Maldives. They're up there. Costa Rica is one. Most of Europe is not permitting leisure travel. They are permitting study abroad travel. If you are carrying a certain number of credits and you are a legitimate study abroad with a full caseload and you have a legitimate need to be there. So you're in the interesting position for the vis-a-vis the rest of the US population is you have some possibility to travel for study abroad if your school is going to accept your credits, and not all schools are. But straight up leisure travel, less likely, and that's something you're gonna have to go look online at the country. And sadly, we've seen some changes there. Spain did open up briefly for the leisure travel, and then they closed back down within a few weeks. So there's a bit of a cat and mouse game going on with travel regulations right now and travel restrictions imposed. And certainly if you look today as the most governments' reactions to new and unclear, like these new variants that are there, is to reimpose travel restrictions as their first reaction as they assess the situation.
Interesting. I have another great question. It says, can you speak more about COVID-19 variants? We are seeking some recommendations to wear double or triple masks.
So it's an interesting one. And I have seen the recommendation of that, and even Dr. Fauci came out and said, you know, we recommend, you know, saying a double mask is a good idea. And certainly any public health officer is going to say, you know, the better masked you are, the least likely you are to get it. And I'm sure, just like I have seen when I go about my business and I go into the grocery stores, people's capacity to wear a properly fitting mask varies greatly. And if you happen to watch football and watch any playoff games, the number of noses I saw was really disturbing out there. So a lot of the recommendations that are out there with the masking and double masking are to do with basically ensuring you have the right fit and you're fully protected and fully covered. There are changes, though, in some of the masking requirements coming out now in response to these variants, including Germany is a good example. They're requiring N95 masks if you're going on public transportation, or the European version of that, which is SS14 or SS41 or something like that. The concern about these variants chiefly seems to stem around is that several of them, and remember, you know, the disease has mutated thousands of times already, right? We are seeing some mutations and some variants appearing out of the UK, out of South Africa, out of Brazil that are causing concern, because certainly the one out of UK is, all signs are indicating that it is a more easily transmitted disease, meaning that, you know, if you go down to 3 feet rather than 6 feet, your odds of getting it go up higher. If your mask slips, you know, the safety net is nowhere near as strong. So the bits out there about wearing either an N95 mask, which is a greater layers of filtration. France is calling for, don't just use these cloth masks. What's happened around the world is everyone embraced the cloth masks, but they're saying the surgical masks are better. So what we're seeing now is, you know, wear the disposable surgical mask underneath, and then put on a cloth mask over top to ensure the best protection possible. I anticipate there's going to be more guidance on this as the world moves along. And I'm not against double masking in the slightest, but I understand where it's coming from, because everyone is also saying that proper masking, proper distancing protects you equally well from any variant that's out there. It's not more likely to get through a well-protected person than another. However, if you are not very well protected and you've got spaces on the side of your face, you don't have a good fitting mask, well, that's problems. How's that?
It was very helpful. So we have a question again from Matthew Estrada, who is asking, what is your recommendation for multi-country trips?
I'm against them completely. Sorry, I get a little blunt sometimes, so I'll be direct on this one. Ready? Here's the issue. You got a multi-country trip. You're going to have to get pre-testing to get on the airplane to go to country X. Let's pick on a country, Spain. How about that? You're going to Spain, or tell me where you want to go, and I'll name some neighbors. You're going to Chile. You have to get tested to get to Chile. You have to arrive in Chile where you get into Chile. And then you've got a trip planned where you're going to go to neighboring, I don't know, Uruguay. However, Uruguay has their own travel restrictions that require testing prior to arrival from Uruguay, whether you're coming in from Chile or if you're coming in from anywhere else. You're going to have to get retested again. Now, you go over there to that new country, you travel around there, and in the 10 days you're traveling this other country, you know, fears about the variants raises, or there's concerns about a spike in an outbreak, and the country there where you're ticketed to fly out of, because that's where you flew into, now has imposed new restrictions and you're across the border and you can't get back in. I'm saying, in my mind, you can mitigate that risk by deciding, you know what, I'm going to really love Chile. I'm going to stay within the borders that I got permitted in. I'm going to explore this in great detail. And my experience with my 20 years in Africa, and, you know, I lived 4 years in Sierra Leone and 7 years in Madagascar and 5 years in Kenya. I came to learn and respect. And as a student, I did study abroad, and I did the If This Is Tuesday, This Must Be Belgium whirlwind tour. Man, I learned about the places I spent the most time in so much differently and so much deeper, so much beyond the superficial first impressions to understand the meaning of meeting. So I'm a strong advocate of pick a place you want to go learn more about and go there and learn more about it. The cursory Reader's Digest version of travel that we've embraced for I'll even get obnoxious about all passport show-offism. It doesn't give you the same level of detail about knowledge of people, culture, language, and place that you get from going and being there for a while. So from a risk standpoint, Multi-city, multi-country increases your risk from a cultural standpoint, an intercultural standpoint. You learn more by being in one location. And that one is a personal choice.
Awesome. Thank you so much. So we have one final question, and that is asking ultimately, when do you think travel will return to what it was before the pandemic? Or in better terms, do you think it will ever return back to normal?
Yeah, I think, so I'm trying this on right now. I'm trying on this concept of we're not going to return to normal. That normal is gone. That the pandemic has fundamentally changed how we think about life. And I'm not really sure we want to really go back to normal. There were certainly some realities about that normal that were cool, but some that were not particularly the world we all were wanting to live in and hoping could be. So I'm going to posit that right now that I think the pandemic's here with us to stay. We're going to see some societal changes as we cope with this. I'm hoping we won't all have to be masked forever, but I do believe that, you know, this disease is changing some fundamental ways of how we look at the world and how we think about the world. And I'm not sure that's a bad thing. There are bits we're going to miss. There's bits I'm going to miss. But I think if we hold on waiting for the quote unquote return to normal and keep slapping band-aids on this world to sort of, as we wait for it to return, we're losing today. And that this is going to be with us at least 18 months, 36 months. You know, there's going to be outbreaks that pop up in various locations in various times that are going to require a return to this normality that we're in right now. So I think we might all be better served sort of figuring out how to embrace this and learn the values and the things we need to learn at this point. And as the world shifts, we'll shift with it. I mean, the world changes all the time. Certainly you can look back to what was normal 10 years ago, and it's even pre-COVID, those things were no longer normal. And I'm not talking about your joy of watching SpongeBob. I'm talking about sort of the things we did and how we interacted, our ability to learn online. I mean, heck, one of the positive things right now is, I'm not going to say that there was a medical lockhold on the need to go visit the doctor's office, but telemedicine and the expansion of telemedicine right now is a world changer. Our access to medicine and high quality care via computer screens can be spread in low cost everywhere. And the medical community didn't accept that modality. Now they do. And that's really kind of interesting. So I'm gearing myself in for the long haul here. And maybe that's just sort of my modality, which is I work best when I don't know, assume the worst and be happy when it's not so bad. But it does allow me to embrace what's here now and not be disappointed at what it isn't, and allows for, I'm working with organizations. So how do we pandemic proof all of our programming and pandemic proof our company, and not just wait for a return for low cost travel, multi-city stuff? I think we're years away from that.
Well, thank you very much for all of your insights. We really appreciate it, especially during these times. So I do want to say I'm going to now transition to sharing my screen. So Bill, if you'd like, I can take over now.
Great.
Perfect.
Thanks for the questions, guys. And apologies for the any too directness, but why not be candid?
That's why you're here. So again, we would like to thank Molly and Bill for all of their insights and all their time here spent with us today. We really appreciate it, like I said, especially during these times. And so right on the screen, we have our QR code for our post-assessment. We will also be sending out this post-assessment via email, and it's due February 5th. Also, I would like to reiterate that if you are here for a required program or just to be counted for attendance today, we will need this post-assessment filled out. So again, thank you so much to Bill and Molly and everyone at CIEE who helped create this amazing presentation. We really appreciate it. And now I will send it off to my director, Dan.
Hello, everyone. Thank you once again for Bill and Molly for that awesome webinar presentation. it's information we don't necessarily want to hear, but we need to hear at the same time. And we'll be working more closely with them and doing global internships in the future during this semester. So if you're interested in that, please contact us too. My email is right on the bottom there. And even though that we love to do these webinars, we love even more to return to traveling around the world. So Bill, I love that Swiss cheese model that you offered, but if we could all mask up, social distance, and if you have the opportunity to vax up, do that as well, and we can all bear down and travel again. So thank you very much, and we'll return to these webinars the last week of February as well with some really interesting more webinars that involve travel and virtually traveling with us. So thank you once again, CIEE, for that information, and we look forward to working with you in the future.
Thank you, and thanks for your attention. Bye.